Of course, in terms of symptoms of arthritis, the biggest symptom, the one that is pretty much the one that brings patients to the office, is pain. If your joint was a little stiff but wasn't painful, most people wouldn't take time out of their day to come to the office. So pain is the overwhelming symptom which leads to patients coming to the office, which leads to recommendations for treatment, and the severity of the pain can affect the recommendations. The pain tends to get worse with activity. It can intensify, ironically, at night, and oftentimes we think it's due to the fact that, quite simply, you're not busy at night as much as you were during the day with all your activities, and sometimes you just have more time to think about what's ailing you. It interferes with normal daily activities, particularly with hips. Stiff hip, painful hip sometimes can make it difficult even to bend over to pick something up or tie your shoes. Swelling tends to be more noticeable with the knee. The hip joint is deep. It's shrouded by thick layers of muscles, the gluteal muscles and other muscles. And so if you have swelling in your hip, it's often really not noticeable at the surface, whereas the knee is closer to the surface and swelling is more obvious to everyone when there's arthritis in the knee that's creating irritation.